And welcome back to Community Connections. I'm Marnie Yu, your host, continuing our conversation on what's going on in the area, all the wonderful people doing things, and our community partners. Joining me now is Laura Dreibelbis with the Susan J. Ream Adult Daycare Center. How are you?
I'm very well, Marnie. How are you?
I'm great. You guys have had probably so many challenges continuing the programs and what you offer to our folks during this pandemic.
Absolutely. There's been many challenges, but we've been able to overcome those challenges, and we recognized how impactful isolation was for our seniors in our community. And so we made the decision to reopen our day center June 24th, and we've had great success since we opened. We have put a lot of best practices in place to create the safest environment possible. So we actually removed much of our furniture, probably about 40% of our furniture from the day center to create an environment that would support social distancing. We, of course, have increased our infection control processes and have a cleaning schedule. We're cleaning throughout the day and, of course, have increased that at the end of the day as well. We have adapted our activities so that our participants don't have to share supplies. So if we're playing a dice game, each one of them has their own set of dice, so they're not having to share that and pass that on. We do provide transportation throughout the county, so we go all the way to Paulden and we can go as far as Cordis and everywhere in between, including Prescott Valley.
Right.
And so when we're transporting on our vehicles, we're only transporting 3 or 4 people at a time. So we've had to add some additional runs to meet the needs of all of our participants, but we've been successful in doing that as well.
Well, let's go back and share a little bit about what actually you do at the Susan J. Ream Adult Care Center.
Great. So we are a medical model of an adult day program, and really what that means is that we have nurses on staff, we have caregivers on staff, and we can provide a higher level of service for those that need it. But not all of our participants need a high level of service. Some of our participants are independent and actually live in their own home, and then some participants do need total assistance while they're visiting us. And when they come in, they get meals, breakfast, lunch, and a light snack in the afternoon. We have a full-time chef who prepares all of our meals in-house, delicious, homemade, healthy meals for our participants. We provide a great environment for socialization, so participants can socialize with their peers. And in addition, we have a variety of activities. We focus on physical activity. We focus on exercise for the brain, so there's a lot of trivia games going on, card games, dice games, some arts and crafts, cooking activities. We have a woodworking room.
Wow.
Yes, where our participants are working on some fantastic woodworking projects. Some people like to do puzzles. We have an outdoor patio area, so when the weather is nice, we have gardening activities and outdoor activities for people to enjoy as well.
So this is a adult day care program,
Right.
centered around activities. So there's things to do, but basically to get somebody out of the house,
Right.
and give them someplace to go, and it's just fairly structured.
Yes. Yes. We are a medical social model. So not only are we focusing on those social needs of our participants, but it is one more set of eyes on the overall health of our participants.
Now, do your participants come every day, or they can make their own schedule?
They come about 2 to 3 times a day. Some people come every day. It really depends on what the needs are for the family and what their funding is.
Okay. So there is a fee to participate in the program.
Yep. And we have long-standing contracts with the Veterans Administration, with Altex, the state Medicaid program, with the Area Agency on Aging, NACOG, Division of Developmental Disabilities.
So if somebody's watching and they're thinking this would be a great opportunity for a family member, a friend, but they're not quite sure how they would afford it, best to talk to you, right?
Oh, absolutely. Give us a call. I will schedule a after-hours tour. Right now, we're not doing tours during opening hours, but I'm always happy to do that after hours.
And then one of the things you've been doing is give the opportunity of your participants to get their COVID shots,
Oh, absolutely.
the vaccines.
Right. So all of our employees and our participants have had the opportunity to get a vaccine.
Right, and so that's
And we had a vaccine clinic just recently on January 20th, and they'll get the opportunity here in a couple of weeks to get their second vaccine.
That's nice, because that's that kind of that mid-level vulnerable group that doesn't get a lot of socialization or getting out, but when they do, could be very, very at risk for exposure.
Absolutely.
So that's, and you're making it convenient, because, you know, as we would talk about getting those appointments, I mean, we've got a hotline number now here we shared with you, that people are running into those obstacles of getting appointments, and sometimes the most at risk are the folks that need that a little extra assistance and can't get it. So you're making it possible and good for you.
Right, absolutely. And we look for many different opportunities to make it convenient for our families. Many of our participants are living at home with a family caregiver, and they have a lot going on. So if we can find a way to make it more convenient for our participants and their family members, we're going to do it.
Right. Is there a contract that has to be signed in order to say I'm going to be staying this long or participating this number of days during the week?
It's not a contract,
Kind of
it's a
open?
services agreement. And, you know, sometimes people can, you know, come in and give it a try, and if it doesn't work out, there's no standing contract that says they must attend for a certain amount of time. However, we are really not designed as a drop-in program,
Okay.
so routine is really important. And so our participants that come, they choose a schedule based on their needs. Maybe that's 2 days a week, 3 days a week, 5 days a week.
Right.
It just depends, and each participant is different, and we work with them, and we are very flexible with our scheduling.
Yeah, truly, we had a mixer there, it's been several years back now, when we used to have, you know, mixer gatherings for the chamber. It's quite a facility. It is amazing the work you do.
Yes.
Let's tell everybody where you're located and how to get in touch with you, and you know, a little bit more information on if they have some questions.
Yeah, and I want to just add that since the last time you were there and we had that mixer, we've had a remodel done at our day center, and we've had an update. It's fresh and bright and fun, and I invite you to come back. I can't wait
Get
till
that
we can do
after-hours tour.
another mixer. Yes,
You're
but-
first on the list.
Yes, we are located in Prescott Valley. Our address is 3407 Windsong Drive. Our phone number 928-775-3563, and give us a call, and I'd be happy to schedule a tour.
And you're right across the street from our previous guest from the landings of Prescott Valley. So that's just a nice little corridor assisting our folks and taking care of, you know, people in our community. And love you.
Absolutely. Well, thank you. Love you
Glad
too.
you're here. So I'll
Yes.
definitely get that mixer scheduled and obviously come for that after-hours tour again. The
Yes.
Susan J. Ream Adult Day Center. And Laura, thank you for joining us.
Oh, Marnie, thank you so much for having me.
All right. Have a great
Appreciate
2
it.
weeks.